Okay, so I got to tell you about this. This is interesting. Israel was the first country to get the Pfizer vaccine. They really have, interestingly, operated as the guinea pigs on the vaccine in general, and they have been really keeping tabs of their data. They've actually been the best country to follow in regards to COVID and the pandemic because of the data that they've been keeping. Well, recently we've all heard about the spike in COVID. Oh, COVID is everywhere. Oh no, it's back. Everybody put on their mask. Maybe we're gonna have to lock down, right? Everybody's really worried about this. And for good reason. Check out this tweet and this letter that came out. This is from Dr. Eli David. He's been following this quite closely. He says, breaking: Israel Ministry of Health orders all hospitals to conduct PCR COVID tests for all admitted patients. And he says, here we go again. And here's the letter that the Israeli Ministry of Health sent over to to the hospital, saying we want you to test every patient. In fact, we have the translated version. And he also tweeted out that here's the update. It turns out the hospitals basically said, go F yourself. They're like, no, we're not doing that. We're not falling for it. And this is incredible. This is an incredible thing that the Israeli hospitals are saying, never mind, we're not going to do this. Because what we need organizations. We need them. The individuals have been doing this throughout the pandemic, saying, no, I don't want to do this. But at the end, it gets to the organization level. If the organization is able to say, we're not going to do this, we're not going to go down that road again, that is how we ensure we don't go back to where we started with this pandemic. So this is why this is so important. So he tweeted this out. Israel Ministry of Health ordered hospitals to test all patients for COVID. The hospitals responded by telling the ministry to F off in professional language. And here's the translation that was provided by Gal G. So this is what it says. This is what the letter to the hospital said. Now, this is in English. It originally was in Hebrew. In the last month, we have witnessed an increase in the cases of COVID, both in the community and in the hospital system. Today, most morbidity is diagnosed through home tests or by clinical diagnosis without laboratory tests, which makes it difficult to estimate the extent of morbidity at this time. So it is clear that it reflects underreporting, right? We've been hearing, oh, we're underreported. There's more cases. There's more, all of this. It says, in order to evaluate the extent of current morbidity and to set a policy accordingly, we are requesting that in the next 3 weeks, from September 3rd, their dates are backwards, September 3rd to September 24th, you will perform a PCR test for COVID to all those admitted to the hospital, to hospitalization in the internal departments at your institution. Thank you for your cooperation. And this is what the hospital said to that. They said, we received your letter requesting to carry out COVID PCR screening tests for all admitted for hospitalization in the internal department for 3 weeks, regardless of the reason for the hospitalization. We understand the need for the health system to characterize the morbidity and classification of the virus. In our professional opinion, performing the test for all hospitalized patients will not bring effective information. On the other hand, this volume of activity imposes an unreasonable workload on us, especially in laboratories that are already very busy. In addition, this will result in considerable expenses of the purchases and salary budget in a period that is economically challenging. With great respect, the amount of patients arriving for hospitalization due to COVID is low. I'm going to repeat that. The amount of patients arriving for hospitalization due to COVID is low. Therefore, it may be preferable to conduct this testing survey in the community where most of the patients with respiratory symptoms are located, and there'll be a more significant effect to the survey there. The public hospitals will continue to perform PCR tests according to clinical judgment. So this is great because these Israeli hospitals are saying, we've already been there, done that. We're not going to test every single patient who comes in because they got into a car accident or they sprained their ankle or they're here for something completely unrelated to a respiratory illness. And you want us to test all of these patients and then get back to you with the number of hospitalized people with COVID. And that's the stat they'll use. And then since Israel was the first country contracted with Pfizer to give out the vaccine, then what do you think they would do with those numbers? If they saw that, oh my gosh, hospitalizations are up with COVID, look at these numbers, what do you think Pfizer's going to do? Is they're going to say, well, we got to give out this new booster that we've just unleashed. We just got this new booster out. Very few people took the last booster. The data was very low. People were not interested in it. So what are they trying to do? It seems like they're trying to boost people's interest in the latest and greatest vaccine that they've got out. They want people to feel like, I got to do it because look at those hospital numbers, they're skyrocketing. And so when you've got the government entity, which is already contracted out with the vaccine entity, and they're now pressuring the hospital entity to test people in order to essentially come back with astronomical numbers of COVID in the hospital, that is, that's a racket, really, and it's a financially beneficial one for certain groups of people, and financially detrimental to others. That's what the hospital system is saying. This would take up so many of our resources, money, salary, time. No, we're not going to do it because the vast majority of people who are showing up here at this hospital are not showing up for that, but for something completely unrelated. And so, why would we need to test for that? So glad that there's institutions actually pushing back. That's what needs to happen more if we're going to get out of this pandemic. Really, truly, it's going to take companies saying, we're not wanting to do whatever it is you're wanting to do. You want us to do mask mandates? We're not going to do it. You want us to test everybody for COVID? We're not going to do it. You want us to lock down and send everybody home to work or shut our doors and put tables outside in the middle of winter or tell people they can only pick up to-go food? We're not going to do it. That's what it's going to take. It's going to take the big companies, the hospital systems, all of these, the big players. It's the individual. That's also very important. But nothing in this country talks greater than money, unfortunately. And so it's going to have to take those corporations to step up. And it's good to see this. It's good to see that this Israeli hospital system has stepped up and said, no, no, thanks. Thanks. We're done. We're done here. All right, guys, let me tell you, gold is something a lot of people are very interested in right now because they're worried about our economy. Things aren't looking so good. You've got a lot of countries starting to band together, kind of looking away from the United States, not so sure about how the US dollar is going to fare. If there's a competing global currency, a lot of people are worried about that. And the fact is, there is one asset that has withstood economic upheaval and has a history of being incredibly stable, and that is gold. And you can find out how you can get yourself some gold. You can invest in gold. There's a variety of ways to do it. You can convert your existing 401ks or IRAs into 401k or IRA in precious metals. You can also get yourself some physical gold. I'm a big proponent of that. I think owning your own physical gold, put it in a safe somewhere, put it, even in a safety deposit box, wherever you're going to put it. But I do think that owning physical gold is the way to go. That's just my personal but talk to the professionals, find out for yourself what's best for you. Visit birchgold.com/Kim. You're going to get a free info kit. The professionals there are going to hold your hand through the entire process. Birch Gold has an A+ rating with the Better Business Bureau and thousands of happy customers. So visit birchgold.com/Kim to get your free info kit on gold. Again, birchgold.com/Kim to get your free info kit on gold.